It's another episode of the About Mansfield Consumer Advice Series. I'm your host, Steve Cosio, and thank you for being here today. And to my right, your left, it's Dr. Joseph Adams. He's with Calibration Chiropractic and Functional Health. Today, our continuing series on migraines. First of all, Dr. Joe, welcome back to About Mansfield.
Thanks for having me, Steve.
And last week, we talked about the 5 triggers. We didn't really get in depth on the 5 triggers, and today we're actually going to talk about 3 of the 5 triggers that trigger migraines. And so, if you or someone you know is a migraine sufferer, you may want to either listen in or refer someone to this podcast. And so, first of all, going through the 5 triggers again. Let's see if I remember this: hormonal, diet, structural, neurological, and help me out.
And then it's going to be stress levels.
It's stress levels. Okay. Let's start with structural triggers. And what are the structural triggers?
Yeah. So with structural triggers, most of that's going to be coming from the neck. And it makes sense, right? Because the neck is really close to the head where people experience pain. And a large reason for this is that the neck houses what's called the trigeminal nucleus, okay? And the trigeminal nucleus is a portion of your brain and spinal cord. Really, it's in the spinal cord. In the brainstem, and that nucleus is huge. It takes up, majority of 3 levels of your brainstem, and it's responsible for head and face pain. Yeah. The trigeminal nucleus is, and it sits right there in the brainstem. And the reason I bring that up is because for you to sense pain in your face, you have a huge region of your brainstem that is responsible for sensing pain in your face. Yeah. Huge. And it's proportional to the rest of the parts of the brain that sense pain. It's just so much bigger for such a small region of your body, right? So this is a very small region of your body compared to the rest of your body, and to have such a big area in the brainstem that's responsible for it, that's why the neck, in my opinion, really matters.
And keeping that under control, I would assume there are several ways of keeping that under control. So I would assume then, if it gets inflamed, that becomes part of the migraine process.
So anything that triggers that trigeminal nucleus or complex is going to create facial pain for you. Whether that's a headache, like a toothache would be still trigeminal, and there's some correlation between dental problems and and headaches and migraines as well. But one thing that is really important to understand about the neck is that if you have neck tension, you're going to have more triggering of that trigeminal nucleus. It's going to get fired up. So you have to keep your neck loose if you're a migrainer. So you can do that many different ways. It doesn't necessarily have to be through chiropractic, even though obviously I believe that chiropractic is one of the better ways to do it. But it can be done through stretching. It can be done through massage. It can be done through acupuncture. It can be done through chiropractic. It can be done through craniosacral work. So there is a lot of different ways to take care of the tension of the neck. So you have to keep your neck loose. And there are some spots in the neck that I've found over the years that are the most important spots to keep loose. And they usually contain a knot. Yeah. Or what I would call a trigger point. And some of those trigger point locations are at the base of the skull, also right here on the side of the neck, in the lateral part of your shoulders, and then right here in this muscle in the front, the SCM or sternocleidomastoid muscle. And so you can even kind of check that on yourself, because if I go up here and kind of feel around, I don't really have any tenderness here, but I don't have migraines. Yeah. But you may find that you're very tender in all these locations. So if you find that, you need to have massage therapy work that out, or chiropractic care, or stretch. to loosen that up, because that's one of your triggers.
What are some of the stretching exercises if someone is interested in doing that at home?
Yeah, so my favorite one for the top of the neck right here is to get a massage ball or a lacrosse ball, really any ball that's small enough to fit up there, and you can lay on the floor with your head on that ball, and you can go up, down, left, right, and massage those trigger points out of you. And you may notice that when you're doing that, you may get a little bit of like a traveling pain that goes up into your head, and it may feel very much like the pain you get when you have a migraine or a headache. That tells you you're working in the right spot.
Oh, wow.
And so you can do that for a maximum of, let's say, like 2 minutes, or if the pain dissipates earlier, and do that on, maybe a daily basis. But be careful, because if you do, too much or too often, you could, put yourself in a situation where you actually cause more head pain, more migraines.
Do you have more structural advice, or should we go on to nutritional?
I got one more structural thing I think would be really helpful for people, would be just doing a trap stretch. So you could just grab a chair, right? So I'm just sitting here, and I can take my right hand, hold the bottom of the chair, bend away to the left here, and then down. And then I can apply some gentle pressure up into the right here for about 3 seconds.
Ooh, I can feel that.
Let it go, and then just pull myself down just a little bit more, and you get a really good stretch there. So that's a good way to take care of these muscles and these muscles, which are the ones that seem to cause the most trouble for migraine patients.
And for those of you who are not watching the video but listening to the audio podcast, he's talking about the lower part of the neck and the upper part of the shoulder blades.
Yeah, where your traps meet the shoulder blade. Yep.
Okay, there you go. Nutritional. What are the nutritional triggers?
So nutrition, that's the more complicated one, and I'm going to make it as easy as possible for people to just get some relief at home on their own. So I would say that the first thing you got to do is eliminate caffeine. Okay.
Oh,
so,
no.
Yeah, you got to do it. Caffeine does a couple of things. It revs up your nervous system.
Yeah.
And that's why people love it, right? Because it can make you sharper, more focused. But that anything you rev up the nervous system is going to make you more sensitive, right? If you make yourself more sensitive,
right,
you're going to have a migraine. It can also cause issues with blood flow to the brain. So when you have a high amount of caffeine, you actually are shunting blood flow away from the brain and out to the periphery. And that's not necessarily a good thing for migraineurs, because with that influx in blood flow in the brain is a secondary component of migraines that can be another trigger. And then the best diet for migraineurs is a keto diet. But here's the caveat: no dairy.
No dairy. Okay, so help me out here, because I don't know the different types of diets. What's involved in a keto diet?
So a ketogenic diet is a diet that is very high in fats primarily.
Oh, okay.
Okay, and that's why dairy has been, one of the things that people have done with keto is because you can get a lot of fat from dairy, but dairy itself is inflammatory. And the way to really kind of highlight this for people to kind of have like a mindset shift on dairy, because I personally do believe dairy is just not good for humans to consume, is that you're drinking another animal's breast milk.
Yeah.
And there's antibodies in that were made for that baby cow, not for humans, right? So it's kind of it's a mismatch when you eat and drink dairy for your immune system. So ketogenic, is primarily no carb, high fat, and if you can do that diet and also do the no caffeine for about 4 to 6 weeks, it's going to be grueling in the beginning to do that. But once you get to that 4 to 6 week point, you should be able to reintegrate typical dietary lifestyle slowly, and then you can figure out maybe what triggers you have with specific foods, which are most likely going to be the citrus fruit food groups,
right?
Or fruit groups, and then also it's going to be any of the aged meats, cheeses, wines. Anything that's got a sulfurase in it, or sulfur in it, anything that's got tyramine in it, anything that's a high histamine food are the primary ones. And then that blood sugar piece is so important. as well.
Going back to citrus fruits, then things that acidic.
Yeah, so they're acidic. They also tend to trigger more, like histamine in people. They have, components in them that will trigger migraines. And it's really just this acidic citrus fruits that, like limes and things like that we're talking about. Lemons, tomatoes is another one because they're high in histamines and nightshades.
Oh, I love nothing. There are only two things in life money can't buy: true love and homegrown tomatoes.
That's so true.
That's it. Let's talk about hormonal triggers. There are hormonal triggers, and let's specifically get into those triggers.
Yeah, so hormones is one of the biggest ones because females primarily suffer with this condition, and if a female's hormone system is dysregulated, it's going to cause a lot of sensitivity for that patient. And one of the ways we see this wind up, the most common triggering a migraine is those that have a migraine are in or around their cycle. And if you're having a migraine, or even if you just think it's a headache, there's a high probability there's a hormonal component going on here because it's only around your cycle. And so you need to have a hormone test done. And the best test to do for that is a Dutch test, that in my opinion. And the Dutch test is not a blood test for your hormones. It's actually a dried urine test. Huh. And by looking at dried urine, you can get a much more accurate understanding of the different hormone levels. And then from there, we can assess things like your cortisol, your estrogen, your progesterone, your DHEA levels, and melatonin. And so those are all the big hormones that need to be assessed. And if we find that you would say have some of these hormonal shifts, we can work on those with supplements, dietary, and lifestyle changes. It doesn't mean that we necessarily have to be on medications. Yeah. And that's not something that we even do in our office anyway. So we would refer those out to another practitioner who is trained in the medication aspect of hormone management and work along with them as well.
Structural, nutritional, hormonal. Those are the 3 of the 5 that we covered today. Next week, we're covering neurological and lifestyle triggers. And so if someone wanted to reach out, if you are, if you're suffering from migraines, if someone is suffering from migraines, how can they reach out to Dr. Joseph Adams?
Well, the best way probably would be just go to our website, calibrationmansfield.com, because we actually have a downloadable ebook on the website that goes over a lot of this stuff, and it serves as a guide to kind of get you started. So I would definitely go to the website and grab that PDF, but you can find us all over social media and the internet, just searching for Calibration Chiropractic and Functional Health.
That website, calibrationmansfield.com. That, again, Dr. Joseph Adams, Calibration Chiropractic and Functional Health. They're over there on South Main Street right here in Mansfield. Dr. Joe, that's another 10-minute nugget of information, and let's do it again next week.
Sounds good, buddy.
We appreciate you listening to the About Mansfield Consumer Advice Series. By the way, if you own a business and you are interested in being a part of the Consumer Advice Series, if you have the knowledge to give information in 10-minute increments to the consumers, shoot me an email to info@aboutmansfield.com. Again, that is info@aboutmansfield.com. We'll tell you how we can get you all set up. Appreciate it. We do it again next week right here on the podcast.